Working with manufacturers on device identification really needs to be around a common purpose. And really that purpose is the patient, right? I think we're all trying to do the very best that we can for those patients. They're trying to create devices that bring value, and we're trying to implant or use those devices to be able to take better care of our patients. So we really have a common platform. I think the challenge is that common language that we're trying to use. It's really the identification of the common language and how do we tell the same story from their perspective to the patient's perspective, and then through our data standards perspective. Data standards really act as an enabler for CQO by allowing us to have the common language around products and then also how we're using those products on patients. So that common language is really clear from manufacturer, clear into our data that you're seeing on the hospital side. So we are using that to drive the very best outcomes. For my suppliers, I really need collaboration and that partnership. And I need the thinking to be around how we use those products to drive better patient care. I need them to be thinking like that. We're obviously thinking like that. And then how do we come together to drive to the very best outcomes in the long run? We have many gaps that we're trying to address in our systems. We are not a perfect lot of systems in healthcare. They're very disparate systems, and we link them together, and sometimes some of those identifiers that we're taking from the manufacturers actually highlight some of those changes. And so we're trying to make sure that what they're putting on their products, we're able to consume in all of our systems, clear through patient, clear through on the back half to billing, and then into our data. The benefit in device identification for Mercy really is a seamless flow from patient scheduling, right in an OR, clear through our data standards. And so we want to be able to use that one device really to drive everything about that patient and not only pull from our ERP system some of our financial information, but then drive it into our EHR system so we can account for what we've used by patient, each identified product. Funny, in order to advance identification of products, we've really had to almost create alias tables, put stickers on products to work around barcodes that we can't use at the point of patient care. We want every circulator and every OR at Mercy to be able to scan the product once, pull information from our ERP system and drive it into our EHR system, but sometimes that barcode really trips up our scanners. The manufacturers will put little pieces in the middle of our barcode that we can't read, so it stops us. And so we will have many workarounds. One of them is labeling. The other one is creating alias tables. And then you have the multiple G10 problem sometimes where we have 20 or so G10s for the same product. But through the learning of AHRMM, I understand that the manufacturers, they're having the same problem determining whether they put one G10 to a product or not. So I think getting to the table together in that full collaboration mode is really going to serve the patient as well as the manufacturers and the healthcare systems better in the long run.